Hello, my name is Dave Ackberry, and today I'll be talking about meniscus tears, specifically the difference between the red zone and the white zone in knee college, and how that affects your healing. If you've been told that you have a meniscus tear, then you've probably been wondering if it would heal on its own or if you need surgery. The answer actually depends a lot on where the tear is located at in your knee. So let's break that down in a simple way. Inside your knee, you have this structure called a meniscus. It is a C-shaped piece of cartilage, which is located in between your thigh bone, which is your femur, and your shin bone, which is your tibia. Its job is to act as a shock absorber, help distribute weight evenly, it helps with stability, and it allows smooth movements in the joint. Now here's the important part. Not all areas in the meniscus are the same when it comes to blood supply. Meaning, the outer third is called the red zone. This has good blood supply. The middle third, this is called the red and white zones. This has moderate blood supply. The inner third is called the white zone. This gets little to no blood supply. And this matters because blood flow brings oxygen, nutrients, and healing cells to injured tissue. Now let me show you by using this model. The white structure here represents bone structure. The curved pieces represent the meniscus. Now I have divided up the zones by color. The red Play-Doh on the outside is the red zone. The blue Play-Doh in the middle is the red and white zone. And the white Play-Doh in the inner is the white zones. Now, you'll probably notice the arrows over here. The arrows represent blood vessels. What's important about blood vessels is that it comes in from the outer edge, meaning the red zone has strong blood supply. The red and white zone gets some blood flow, and the white zone gets almost none. So what does this mean if you tear your meniscus? If the tear happens in the red zone, there is good blood supply. Your body can send healing cells to the area, and that means it has a better chance of healing on its own or being repaired successfully. Now, if it happens in the red and white zone, healing is possible, but less predictable. Sometimes it heals, sometimes it just doesn't. But if the tear happens in the white zone, there's no real blood supply, so the body can't deliver the nutrients needed to repair. These tears are most likely less likely to heal on their own. That's why tears in the white zones most likely will require medical attention, like trimming the damaged tissue or surgery. So the key takeaway is this. It's not just if you have a meniscus tear, it's where you have it. Like the outer, the red zone, better healing potential. The middle, red and white zone, okay healing potential. Now if it's in the inner, which is the white zone, poor healing potential. That location helps doctors decide the best treatment plan for you, whether that's rest and rehab or something more advanced like surgery. If you're dealing with knee pain or a meniscus injury, getting the right diagnosis is the first step to proper healing. Thank you for listening.